Thank you, Jeff, and good morning, everyone. It's a pleasure to be here. It is great to see so many people here to discuss a really challenging topic, so I appreciate you all coming out. So I'm going to start this morning with a question, and that question is, where does Placer County rank in homelessness compared to other California communities? Someone just shout it out for me. Okay, there are 58 counties. Where do we rank? 47. Maybe a little bit better than that. All right, let me show you that. Placer County ranks the 6th lowest of homelessness statewide, and we're the lowest rate of homelessness in Northern California. And that is the number per 10,000 residents. So in Placer County, we have 18.2 homeless per 10,000 residents. You'll see the red bar in the top. That's San Francisco. You'll see the orange bar, that is Sacramento. That number is 58.4. So we're doing pretty well, and that is really good to see. And these numbers are from 2022. This morning I'm going to talk about a number of things. We'll discuss the annual point-in-time count, initiatives prior to 2021 led by Placer County, recent efforts and successes, the Regional Homeless Ad Hoc Task Force, challenges, and what is it that we can all do. I'm going to start with some alphabet soup and some definitions. HHS is Health and Human Services Department of Placer County. TGI is the Gathering Inn. MTS is a mobile temporary shelter. And CDPH is the California Department of Public Health. So now you know, and if I run into an acronym, you are forewarned. The point-in-time count is a federally mandated count. It happens every year, all communities, on January 25th. The idea is to give communities a snapshot in time every year of the number of homeless in our community. It is conducted by volunteers and nonprofit and local government staff, and they go out and they find out who is sheltered and unsheltered, and it does not count the couch surfers. This is the point-in-time count earlier this year in 2023. And what we will see is 709 people were counted this past January, and that number decreased by 6% from 2022. We were at 750 in 2022. We dropped to 709. That is good to see. What you will see, the orange portion is the unsheltered residents or homeless, and then the blue is sheltered. So 42% are sheltered and 58% of the homeless are unsheltered. Let's take a look at Placer County versus the state of California. The orange is the state of California, and you'll see that the average number of homeless in the state of California is about 43 people per 10,000. And here in Placer County, our number this year is 17 homeless per 10,000. But you'll see the trend line, and the trend line in the state of California is certainly increasing, as is pretty evident when all you do, if any of us drive down to Sacramento. And our number also has that trend of increasing, but we've maintained a fairly stable number, which is good to see. Let's bring this down now to South Placer. And South Placer are the communities basically south of Auburn, right? Roseville, Lincoln, Rockland, the Loomis area. And what we will see is the number of homeless in Roseville, a total of 240, and you'll see the unsheltered, 154, sheltered 86. City of Roseville has 33% of the homeless in Placer County, and the bottom bar is the number in South Placer. We have 347 in South Placer. Basically half of the homeless population are in South Placer, and Roseville has 69% of the homeless in South Placer. Rockland has 6.7% of the homeless. Lincoln has 6.3% of the homeless in our area. A lot of folks wonder what is it the county has been doing, and we've been doing a lot for a number of years. I want to share with you some of those things. We've done a much better job of addressing data and making sure we're tracking who's going where, knowing who the homeless community is. We've done a lot of focus on our chronically homeless with the Whole Person Care initiative, and that really is these folks who have been on the streets longer than 1 year, and we provide a lot of mental health and physical health supports, wraparound services, because these folks are the ones who end up in our emergency rooms, often arrested, and they're the biggest strain on our society when it comes to the cost to providing the needs to the homeless. Back in 2015, we established an emergency shelter in North Auburn, a congregate shelter, a 100-bed congregate shelter. It is now run by Gathering Inn. You can see what it looks like, just bunk beds like that, and that's been effective. And then we've really worked to expand permanent supportive housing and other housing options. Right now, with permanent supportive and interim housing, we have 192 units. And permanent supportive housing are units where people pay a portion of their income, about a third of their income, to be renters and live in that home or that unit. Placer County has definitely expanded our mental health and addiction services, and we've done a lot to focus on prevention, providing emergency rental assistance, working with our nonprofits, rapid rehousing, and then, of course, in the county in general and in the city, there's been a lot of efforts to build more affordable housing. Here's some recent county-led initiatives. A lot of you may know that the former Hampton Inn over on Douglas and Sunrise have now become the Sunrose Apartments. Those will be 82 permanent supportive housing units here in Roseville. Right now there are about 26 people living in that facility while we're doing some additional tenant improvements. We opened up the Lotus Behavioral Health Center in Roseville, and a lot of you may not know, but we do have a psychiatric hospital in Roseville. It is on Kirby, off of Riverside, just across the way from Kaiser Permanente medical offices there. So it's a full-fledged psychiatric hospital, but we were able to get some grant funds and open up a 6-bed urgent care unit, which is an urgent care stay up to 23 hours for those who are having mental health crises, and instead of sending them to the emergency room where they may not get assistance and help, they come to the Lotus unit. They're seen by practitioners. They have a place to have respite and then work with some professionals to figure out what the next steps are. What we don't want is to see people spiraling out. And we have definitely, nationwide, statewide, seen an increase in mental health episodes. We've established mobile crisis teams, and mobile crisis teams are groups of social service folks who go out into the community when people are experiencing mental health crises. They might come to your home, they can go out into the field where the homeless are, but the idea is for these folks to go out to where people are, stabilize, be there, make referrals, and try to address the needs in our community. We also have a probation outreach vehicle, and you might have seen that, but one of the things we've noticed is that we do have homeless in our community, and not all of those homeless are on probation. About maybe 20% of the homeless are on probation, but the mobile outreach vehicle gets to go where the homeless are, allows them to check in, stay on track. It's a whole lot easier to go to the probationers versus the probationers trying to get up to Auburn or up to the Santucci Justice Center. So this has been very effective, and it goes to every one of our communities so that we can touch bases with those probationers and actually be another point of contact and help provide them services. One other thing that's not listed here is the homeless outreach liaison teams. And these are teams made up of Health and Human Services, probation, the sheriff's office. We go to every jurisdiction, and the focus is the folks living in encampments and trying to make sure they know what services are available and trying to reach out and getting them to say, yes, I want to make a step to get out of homelessness. The City of Roseville has similar teams. We also work with the City of Roseville, and they have social service workers embedded in the police department reaching out to those who are homeless. Earlier this year, in February, we opened up the mobile temporary shelter in North Auburn. The Placer County Board of Supervisors, we have a couple of folks here, made that decision because we were at risk of a lawsuit. And instead of giving that money to a group of homeless, we realized, let's utilize these dollars in a way that are more effective. So we opened up a 50-bed non-congregate shelter, a tent shelter. This is what it looked like before we had chairs and benches around the tents. 50 non-congregate units where people had their own space. We had an absolute mess on the government center campus. It was awful. We had up to 100 people at some point, trash and debris. Nobody should be living in those conditions. And so we were able to actually move most of those folks over to the tent shelter. And what we saw was that people were willing to keep places clean. They were willing to come over. There are some rules. There are definitely some rules. It is considered a low barrier shelter, which means people can bring an animal. They do not have to be clean and sober. They cannot, if they're coming down from something, they can come in and rest. They cannot bring in drugs. They cannot bring in weapons, but it is a place for them to go, a place for them to be safe. And so for a lot of these folks who have been fearful, people who have been victims of violence, this is a much safer space to be in versus being on the streets. And we've had very favorable results from not only the campers, but from folks who come to our government center, our visitors, our staff, and our local neighbors, because we've had less people out in the neighborhoods because people have a place to stay during the day, not just moving around. And I want to just share one story about a couple who's done really well. They came into the shelter in April, and during their stay, they were able to take advantage of a lot of the services provided. They were able to help find employment with the help of the staff. They applied for benefits. They secured insurance coverage, all while staying at the shelter. And the idea is get these folks stable, and then what do you need? How do we provide the services you need, whether that's mental health services, addiction services, employment services. And what we know is a large portion of the homeless are either addicted or have mental health needs. And that's very clear. So the goal is get to folks and help provide them the services they need. Back in 2021, as we saw an increase in the homeless due to the pandemic, one of the things I realized is that we as a community, the jurisdictions, really need to work together. Counties doing this, cities are doing this, no one's talking. And so let's talk, let's level set and work together. So we put together this ad hoc task force, and the ad hoc task force has been, the last 2 years, a comprehensive assessment process and a cross-jurisdictional process of who is doing what. And we have a number of members from the task force here in the room. We had 2 elected officials from the county, from each of our 6 cities, members of law enforcement, HHS, probation, and our city and county staff. And the idea was, first, we need to build some trust and some common understanding of the needs and the challenges across the region. We really needed to come together and talk, not just point, but talk about what the challenges are, what we're doing, what we're not doing, and how can we partner together to share our resources. As a group, we coalesced around some shared outcomes. First, we wanted to make sure that we maintained the lowest rate of homelessness in Northern California. None of us want to look like Sacramento. We've done a really good job, but we want to continue to make sure that our streets are safe for our residents, that this continues to be a wonderful place to live, right? We live here because of the quality of life that we experience, and we want to make sure we maintain that. And we want to make sure that we've got wonderful open spaces, parks, other places to enjoy. We heard from our law enforcement, which was really very helpful. Our law enforcement, our probation, these are the folks who are experts. They reach out to the homeless, are in contact with the homeless on the regular basis, and we learned a lot from them. One of the things that we learned, which for me was really shocking, and that is at least 75% of the homeless are from our communities. That means they went to Roseville High School, they went to Del Oro High School, they had a job, they lost their job, they've got kids or parents who live here in Placer County. Placer County is their home, and they are our residents. I know a lot of us think, oh, they're from other areas, coming from other areas. They are our residents. And what we've learned as well is that people want to stay in their communities. So for example, if I live in Roseville and I lost my job and somebody said the only place you could live was in Auburn, I would have a hard time moving to Auburn. I love Auburn, but Roseville has been my home for a long time. And that is no different for the homeless members of our community. If Lincoln is their home, they don't want to leave Lincoln. If Roseville is their home, they don't want to leave Roseville. This is where their networks are. This is where they feel safe. This is where their friends are. As a group, we realized that if we're going to address the issue, we want to have more decentralized housing and supportive services, not some huge, large facility. There's been lots of talk about the Campus of Hope, and I appreciate the efforts of the Gathering Inn talking about a concept like that. And it really did force us as a group to say, what do we really need in South Placer? And none of us felt like a 500-bed unit was necessarily what we needed here in South Placer, especially when we learned about the fact that folks want to live in their own communities. So we'd much prefer to decentralize the efforts throughout our region. We certainly need to leverage existing behavioral health supports, and housing is definitely more effective when we have accompanying services. So when we look at regional solutions, we really want to balance compassion with accountability. It's not just throwing money at the problem, but it's actually providing those services that people really do need to get off the streets and move forward with their lives. So let's talk about additional challenges that we have as a community. I want to talk about the future of the South Placer nomadic shelter model, the evolving landscape here in the state, and the fact that we currently do not have any type of permanent stable shelter here in South Placer. Most of you may know, you may not know, that we have the Gathering Inn that has for the past 10 years provided a nomadic shelter. And the nomadic shelter is a shelter where we have participating churches who bring the homeless into their church, provide them a meal, allow them to sleep, and then in the morning they come back to the location at Berkeley in Old Town Roseville, and then they are dispersed for the day. And then it repeats. So every night, 6 p.m., they go to a different church. That was a temporary solution that's been going on for 10 years now. And what you'll see is that the last couple of years, there have been 55 residents typically utilizing these services. Back prior to the pandemic, we had 39 churches serving the homeless with the Gathering Inn. Because of the pandemic, in 2023, we now have 22. The number is almost half. And why is that? With COVID, most of the churches who served these residents were older, and the fears of COVID meant that they shut their doors and their programs, and those folks have not necessarily come back. And church membership has been on the decline. So now where you had 39 churches, you have a lot fewer churches doing a little bit more work. And you'll see that now there are 2 churches, Father Cliff's Church, St. John's, thank you very much, There are 2 churches that take on 25% of those nights every month. And that, thank you, but that is a burden for our community. We definitely could not do this without the community, without our business partners, without our faith-based community. So the Gathering Inn right now, the nomadic shelter, is the only overnight shelter we have in South Placer, other than Home Start, which is a women and children's shelter here in Roseville. The maximum capacity is limited by the size of the smallest church, which is 65 guests. It turns away an average of 15 guests a night due to capacity. It's not always easy to accommodate guests with overnight or nighttime jobs, evening jobs, because if the shelter is in Loomis and you are working a job here in Roseville and you get off at 10 o'clock at night, not so easy to get over there. And then I mentioned the declining number of churches. The other thing about the Gathering Inn nomadic shelter is that it is a barrier shelter, which means in order to come to the Gathering Inn, you must be clean and sober, can't have animals, you need to be a little bit more stable. So for folks who are struggling with substance abuse, they are not able to come into the shelter. Thus, they stay on the streets. So the question is, if we were to lose the nomadic shelter, and not that it's going away right away, thank goodness, we have a great team of people, but at some point, it's not a sustainable model. So right now, we have 100 total sheltered homeless here in South Placer. That includes the Gathering Inn and Home Start. 65 of those are the Gathering Inn beds. If we were to lose the nomadic shelter, we would add an additional 65 people to the already 247 folks who are unsheltered in South Placer. And we would see that on our streets. Let's talk about the really fun legal landscape in the state of California. Many of us have heard about Martin versus Boise, and Martin versus Boise basically says that we need to have shelter beds to enforce no camping on public property, and that was upheld by the Supreme Court. Johnson versus Grants Pass reinforces Martin versus Boise, and it says that municipalities can put restrictions on where and when people can camp, but they cannot prohibit people from sleeping somewhere, right? So we have a fundamental right to rest. And so we need to allow people to rest. We cannot just keep moving them off, and enforcing no camping if we do not have a place for people to sleep. And that's really important, which really affects us. Then we have the state of California. The state of California has a housing first policy. Get them into a house, and that should take care of the problem, which we know does not. Because just putting a person into a place to live without supportive services, if they've been on the streets for several years, it's not going to help them get the services and the help they need to get out of their situation. There's been some recent state legislation, the Care Court, we've heard about that, and some changes to the Mental Health Services Act. And I'll share with you this about Care Court, which will begin at the end of 2024 for our county. But the idea is to take those with severe schizophrenia, mental health issues, and take those folks to court. They could appeal to a court, and then there would be some type of conservatorship where they would have to get some type of service. The challenge, they'd have to be basically institutionalized and get services. The challenge is that that's a very small portion. It's estimated that state of California would be able to do this with about 7,000 to 10,000 residents total. And so it affects our homeless population maybe a little, but not significantly. So let's talk about the elephant in the room. And the elephant in the room is, do we need some type of what I would call, and our ad hoc group is called, a navigation center versus a shelter? Because the idea of a navigation center is that you say, yes, I'm willing to get some help, get off the streets. and we navigate you through the process. What do you need? Mental health services, addiction services, employment services. Most people stay anywhere between 30, 90, 180 days. It is not meant for people to stay long term. And so right now, we do not have a location for people to come and stay overnight to allow us to be Martin versus Boise compliant. And a lot of us would like to not see homeless in our creek beds and in our parks. But if we don't have a place for them to go and move them to, we cannot enforce no camping. So will it make a difference if we were to add a navigation center? Here's a graph by our subregions. So North Auburn and South Placer, these are the unsheltered in our community. So you'll see South Placer, Roseville, Rockland, Lincoln area. Back in 2018, we had about 47% of our homeless in South Placer who were unsheltered. We are now of our homeless, 71% of the homeless in South Placer are unsheltered. North Auburn is the green, and that number has remained relatively stable because we have 150 shelter beds in North Auburn, 100 congregate, 50 non-congregate. So we've been able to keep that number fairly level. And what happens is once somebody gets into a shelter, they don't stay there, right? You get them services, they move on. We move people on to different options. Sometimes they go back home. Sometimes they maybe move back to Arizona because that's where their family is, and they've had help to get to that next step. But in South Placer, our numbers of unsheltered have increased because our only shelter beds have been the nomadic shelter. So what might be our need? And I say what might be because nothing is set in stone, but I share with you that there is a need. And that is, right now, if we were to lose the gathering in, the nomadic shelter, we would need about 65 emergency beds. In addition, those folks who would only qualify for a low barrier shelter would easily be about 50 people right away here in South Placer, would be willing right away to get off the streets and into something like what we have in North Auburn, mobile temporary shelter, which could be about 115 units. What I want to say is we don't see a large one-stop shop location, and things can be scaled up or scaled down according to the need. So in North Auburn with those 50 tents, the idea is if we get more people, we do not. If we have to expand a little bit, we can expand. But the idea is we can be flexible. If we're to have some type of shelter, one of the things we did is with the ad hoc group, we talked about we need to have some siting criteria. It can't just be right next to a neighborhood. We have to look at what would work for some type of navigation center. We'd look at the scale. We'd look at what it costs to acquire or lease land. What are the physical features of the facility? What is the infrastructure availability? Just putting a shelter in an empty lot does not make sense because you need water and power. So where's the location? Is that location accessible to services? What are the zoning considerations? And then the financial stability of that proposal. And I want you all to know that no decision has been made regarding a shelter or any specific location. I do not have an idea in my back pocket that I'm going to spring on everybody. I do have some thoughts, and we have had conversations that there might be some locations, but nothing is set in stone. So to wrap up, this is definitely a societal issue. We've done a very good job as a community, but if we maintain the status quo, the numbers will very likely increase because we do have issues with mental health and substance abuse. Really great work is being done by the county, by our local cities, and our other nonprofits and community organizations. When we address the homeless, we reduce the costs to law enforcement and our emergency rooms. Absolutely. The homeless residents are from our community, and we do need to look at a South Placer solution and a navigation center. And I come back to, this is really about addressing an issue with compassion, but also accountability. It's really important that we just don't put people into places to live. We really look at what are their needs. They got to the streets after they moved from place to place to place, wore out their welcome, and now they're on the streets. And what we've learned is it takes many, many touches for somebody to say, yes, I'm willing to finally get help. And if they, after 10, 12 contacts from a homeless liaison outreach worker or from probation, and they finally say, I'm ready to get help, yes, then we need to have a place for them to go so that we can help them. So really, we have a gap, and what do we do about that gap? And I come back to, like, this is about keeping our community safe. It's about the quality of life here in Placer County. It's about our businesses. I had a conversation with two families that live over here off of Folsom Road, which is right along the creek. And both of these families moved to Roseville because this is a great place to live. They love the creek. They love being able to allow their kids to play on the trails. But now they've got homeless banging on their doors at night, sleeping under their stairs, leaving trash in the creek beds. And that's no longer a quality of life that they want. They've told me when the kids are out of high school, they're moving. And I thought, that is not who we are in Placer County, right? I was so saddened to hear that because I think of this as a wonderful place to live. I also don't see the homeless in my community in West Roseville, where I live. But these folks right here see it every single day. And so this is an effort that we all need to do together. It is not just government, but we need our business community and our nonprofits, our residents, our faith-based community to work together to address these solutions. So what can you do? Lots of things, but what you can do is support our current efforts, any type of nonprofits that are supporting the homeless. You are certainly welcome to schedule a tour of the North Auburn shelters, the mobile temporary shelter. They're happy to show you what they're doing there. Stay connected. Make sure you're aware of what's going on. I do have some sign-up sheets at the table, and if you want to be aware of our efforts on the homeless issue, please sign up. You may already be on my District 1 newsletter, but we are keeping a separate list of folks who really want to be informed about the homeless issue. Well, thank you all very much. If you have additional questions, happy to answer them afterwards. And please, I just want to wrap up saying thank you for your interest. Thank you for really helping us make sure that Placer County continues to be a great place to live and work. We all know that it is, and we want to make sure it stays that way. And that means addressing some of these really challenging issues, but I know that we can address them together. Thank you so much.